Alright, and here we are in Chapter 12, Illegal Drugs. We'll talk first about the illegal drugs for everyone, and then there's a separate lecture audio with just alcohol and alcohol abuse. Alcohol, of course, being a legal drug, like caffeine or nicotine. Nicotine for some, I suppose you have to be of age for cigarettes, but caffeine is not age restricted, and it is indeed a drug. So this section will be all the illegal drugs, and then we'll focus specifically on that legal drug that a lot of us indulge in when we're of age in the later video. So drugs are substances that are not needed by the body but cause physiological or psychological action in the body. And therefore, as I just mentioned, caffeine is indeed a drug. It causes physiological changes, increased heart rate, for instance. Some people it improves mood, right? I know a number of people who I would not call before I knew they had their morning cup of coffee. So again, the drug definition is just that. A substance is not needed by the body that causes those changes in the body. We're mostly focused in forensic science on abused drugs. And so when you abuse drugs, especially over a long time, the tolerance of the body increases and the body eventually becomes physically dependent. This can happen very quickly with certain drugs, but maybe not so much with other drugs. So those withdrawal symptoms that you can have on a very addictive drug like methamphetamine or heroin or some of the other unfortunate drugs that are a problem in our area, if you try to go off them, quit cold turkey without weaning yourself off, you're looking at cramps, vomiting, convulsions, hallucinations, insomnia, chills, all are possible with a cold turkey approach to quitting. Some drugs are so serious that if you quit them cold turkey after a period of use, you could even die. Methadone and methadone clinics are around. I don't know if they're as big as they were in the 80s and 90s, but they do exist to help people off of harder drugs. The methadone itself is a drug. It's an illegal drug, but it's administered just to mitigate those different withdrawal symptoms and help the person through so that they're not running the risk of dying during withdrawal. Why do people get involved in the first place? Of course, it's that sense of euphoria. Although there's at least one drug we'll talk about, PCP, that doesn't give good trips. It's always bad trips. I don't know why anyone would use it. Most drugs do have some pleasant effect that people are after. They're looking to escape. And so if you look at drug abuse, it tends to be either the high-end users, the people who are wealthy and of means, just feel like they've done everything. So your movie stars, they've done it all, they've seen it all. This is a new experience. The other end of the spectrum, you unfortunately see a lot of poor individuals who turn to drugs as a way to escape. They have a very difficult home life, or they have physical or psychological or emotional pain that they're trying to escape from. It's unfortunate that it often leads individuals to seek euphoria through the use of illegal drugs. Alright, so an exercise in bad science, right? What do I always tell you all? That you've got to have your source and you've got to have your dates, and this graphic here is woefully out of date, I'm afraid. I'm pretty sure methamphetamine by now has surpassed cocaine in terms of its use and abuse. Also, if we want to consider things like nicotine and alcohol and caffeine, my goodness, they would be much, much higher. So I probably should have said most popular abused drugs, and I should probably have given a source. I can't even recall the source on this one, but I definitely should find some updated values for you, and I'll announce those in lab. But suffice it to say, cocaine and methamphetamine are very popular illegal drugs. Marijuana, I don't know if that's an underreporting of it, or again, it could just be based on how the data was collected. Maybe the individuals asked don't even consider marijuana a drug because it is a pretty soft drug in certain places, even Colorado State, for instance, it's legal. Recreational use is legal. Of course, federally it's illegal, but the feds haven't come in and stopped anybody that I'm aware of from using the drug recreationally in Colorado, sort of preserving the state's rights there. Heroin, I would assume, at least if we looked at regional values, it would be much higher than 9%. And MDMA ecstasy is probably a little higher than reported here, although, again, if this is a percent of the total, it might proportionally have gone down, while methamphetamine and heroin have gone up, for instance. Cocaine, it's still in use, although it's not as popular. It was sort of an 80s drug when everybody had a little disposable income because of the economy trucking right along. A lot of high-end individuals, businessmen and women, got into cocaine. So if you watch some 80s movies, you'll see a lot of $100 bills being rolled up to snort cocaine. That's the hydrochloride. That's absorbable that way, but as we'll see, there's other types that may be used in other ways. Why would anyone use it in the first place? I don't know, but it is a stimulant, and it does provide energy, so those businessmen and women who are burning the candle at both ends, so to speak, might feel like they need the extra energy. It also does help elevate mood, so maybe they're not as ornery despite having all those responsibilities. Back in 1886, Coca-Cola, right, coca from the coca leaf, Coca-Cola bottles had 60 milligrams of cocaine each. That's quite a lot, really considerable if you think about it. Nowadays they still use the leaves, although it's micrograms, if any, if we can even detect the amounts of cocaine from that might leach from the coca leaf. It's probably nil. Cocaine, as I said, it comes in different forms. It can be injected or inhaled. Usually the injected or the snorted stuff is the cocaine hydrochloride. If you watch your medicine cabinet carefully, you've probably noticed that if you're on any prescription drugs, they often come as hydrochlorides. It helps to make them water soluble and more compatible with the body. They can also be smoked or freebase. So the freebase form, the non-hydrochloride form, gives the name freebasing, and this is for your lower income users. These are the poor that typically, instead of getting $100 bills and snorting cocaine hydrochloride, they're cooking their crack with a spoon, and it makes that crackling sound because of the baking soda. So two different forms, vastly different in terms of purity. High-end businessmen and women, cocaine is very expensive. Low-end crack cocaine mixed with baking soda and other things, much less expensive.
Alright, so the next drug that we'll discuss is methamphetamine. And methamphetamine is a big problem in our area and nationwide. Probably the biggest illegal drug abused, as we discussed earlier, in terms of popularity. For all the forms we'll discuss, it's true that meth is a stimulant. It gives energy. There's also a feeling of euphoria, an escape from reality, going to a happy place, that sort of thing, which is what gets people on meth in the first place. In the case of powdered methamphetamine, a couple of street names for it would be crystal or crank, and some modes of entry into the body. This form can be injected, snorted, ingested, or smoked. So lots of options there, and unfortunately a very popular illegal drug to abuse. Another form of methamphetamine, ice methamphetamine, named obviously because, as you see in those images, it looks like ice. Some street names for this would be glass, batu, or shabu. I'm sure there's some more modern names that maybe haven't even hit the criminal justice end of things. Once criminal justice folks learn the names, then obviously the folks that are dealing the illegal drugs need to change it to keep ahead. So I'm sure there's lots of other names that aren't listed. And this particular variety tends to be smoked. That's the preferred mode of entry for ice methamphetamine. Finally, we have methamphetamine tablets, and these are quite deceiving. They look like prescription drugs. As Will mentioned, methamphetamine was originally used for weight loss as a prescription drug, and it's still legal, I suppose, to prescribe it, although I can't imagine too many U.S. physicians do so. But these particular methamphetamine tablets that you see here and that tend to crop up illegally in the U.S. tend to be made in Burma, or Myanmar, I think is its preferred name now, but it's a country in Southeast Asia, and that tends to be the major source of methamphetamine tablets. And these can either be ingested, just taken like medicine, or smoked if they're either ground or just smoked in a special device. Probably the biggest news in our area is all the meth labs that have been discovered. I think Tioga County, our neighbor there, and I know some of you might be Tioga County residents, was, I believe, at once New York State's meth lab capital. It's very rural. It's easy to hide the meth labs. Although, of course, meth labs aren't restricted to rural areas. That's one previously popular place for them. Meth itself can be made in several ways, and most of these preps use over-the-counter drugs like ephedrine or pseudoephedrine tablets. So Sudafed would be the trade name there. And now if you've bought Sudafed within the past several years, you probably noticed that you have to go to the pharmacy now to get it. It's not out on the shelves. They might have a tag out there or some sort of cardboard or paper that you bring up to the pharmacist or the pharmacy technician. But they'll take your license, they'll monitor how much you're buying and how long a period, and that's all to try to cut down on the use of it as a precursor for methamphetamine. One of the biggest problems of methamphetamine for people other than the cook of the methamphetamine obviously is exposing him or herself to toxic waste, but because you're doing something clandestine and illegal, you're probably not disposing of your hazardous waste in a correct manner. So most of these preps are quite dirty, and you see here we get 6 pounds of toxic waste for every pound of meth made. And again, in the rural areas, it's usually just dumped. You have meth labs operating in apartment buildings. We've had a couple serious fires in Binghamton and the surrounding area because of individuals with meth labs, active meth labs, and they're not only exposing themselves to this toxic waste, but potentially all the other residents of the building, just depending on how they're disposing of it. And all of us, if they're putting it into the waste stream that our treatment center is not ready to handle. So very, very unfortunate situation, not only because it's propagating this illegal drug, but because the preps do involve lots and lots of nasty hazardous waste. Finally, we see here the effects of methamphetamine abuse. We have our top left picture there showing our young lady before, or probably early on at least, in her meth addiction. And then as you watch the progression, 10 years later, we see that she's obviously suffering from malnutrition, very thin. The methamphetamine, as we said, is a stimulant, so her heart's racing all the time. She's probably not eating correctly. We don't see it in that top left, but in the picture to the right of it, where we see the young lady after just 4 years of meth use, you can even almost see that the teeth look unhealthy. So, they're not, meth addicts aren't taking care of themselves. There's usually poor nutrition, poor dentition. You see along the bottom, again, just 11 months later, and then 2.5 years later, how quickly meth has changed those two young ladies. And again, it's not necessarily just the methamphetamine. Oftentimes, with drug abuse of any type, meth in particular, individuals will do whatever they need to feed the addiction. So for young females, oftentimes it leads to prostitution, and then you can have clients or the pimps abusing. So it's not clear why we have those cuts and burns there on our 11-month lower left photo young lady from left to right. Could be that she's making the meth, and there's meth fires, unfortunately. So that could account for the burns, or like I said, it could be a result of being abused physically, based on what choices she may have made to support her meth habit. So all in all, a very dangerous drug, a very addictive drug, and a lot of negative consequences from abusing this particular drug. Okay, so now we move into something a little lighter. Again, marijuana abuse is illegal in New York State, and I certainly am not advocating anyone to try it or use it, but certain places in the country do allow recreational use. Colorado, for instance, has allowed for the recreational use of marijuana and the sale of marijuana or at least THC, in certain consumer products. And again, that's in violation of federal law, but the feds haven't stepped in so far that I'm aware of to limit that state's right to do so. So marijuana itself comes from the cannabis plant. Tetrahydrocannabinol, THC, is the active ingredient. It's typically smoked, although we don't list them, but there are other modes of entry. And as I said, putting that THC in consumer products, chocolates in particular, are popular over in Colorado now, and overseas, where people used to go to places like Amsterdam in the Netherlands. It's been legal for a long time there, and people have vacationed there for that reason in the past, and now it's a much closer destination with Colorado. But yeah, putting it into foods, marijuana brownies, for instance, they were popular in the 70s, and I assume to some extent still today. The reason for using or abusing marijuana would be, again, that escape, the distorted reality, the relaxation of the body. It does lower things like ocular pressure, so marijuana has been used medically for glaucoma for that reason. It also increases appetite, right? The munchies from marijuana use. So it's been used, or at least the THC or a derivative has been used to treat, or at least to support cancer patients. Again, cancer patients with active chemotherapy routines usually don't have much of an appetite, so the appetite increasing properties of marijuana make it medically useful for that purpose. So we have other states that allow for medical use, but Colorado, I believe at this point, is the only one that allows recreational use, although other states like Vermont have started the process to move toward legalization for recreational use. In the right-hand side, we see some different types. Again, they're all cannabis. They're just slightly different varieties. You see the Latin names are the first three words there for the top two, the sativa and the indica. And then ruderalis has just two Latin names, Cannabis ruderalis, whereas the others had the three names there. And along the bottom left, we see some dried cannabis. Another major problem in our area in terms of drug abuse is heroin, and that's of course nationwide, but especially in our area. Heroin's different from the other drugs, especially the other big problem drug in our area, methamphetamine, which is a stimulant. Heroin's a narcotic. It decreases pain, it brings sleep, and so heroin addicts oftentimes were on prescription painkillers, had a tough time coming off, maybe abused prescription painkillers, and then when they weren't able to get the prescription painkillers anymore, they unfortunately they decided to move on to heroin. Heroin's a morphine derivative. It's made from morphine, and it's usually injected, although there are other modes of entry for this particular drug. We again had an issue in our area, as much of the country does. And this one's really tough because the users tend to be still high functioning. You don't tend to see the same sort of very obvious physical effects of abuse like with methamphetamine. So heroin addiction can go unnoticed, and it can be a long-term issue for the abuser. Alright, our next drug, we move into a couple drugs that are known as club drugs. The first one here, MDMA or Ecstasy, typically known as E, is a hallucinogen, so it causes hallucination. And again, these tend to be positive hallucinations. People tend to feel more creative and in a very warm, fuzzy type place. You see that it's available in tablet form, so that makes it seem almost like medicine or candy. It's typically taken orally, so you don't have to deal with injection or smoking. It's readily available in these tablet forms. And when we say club drugs, we mean it's a drug that's typically associated with the club scene. So either the formal clubs, dance clubs, or raves, these all-night dance parties that I don't know if they're as popular now as they were in the past, but they were typically fairly popular among well-to-do white adolescents. That was the first big population to get into ecstasy, and now, of course, it's moved on to more general populations, but that's where it starts. Rohypnol is another club drug, although this one is very different from MDMA, ecstasy, because this one tends not to be intentionally abused by the end user. So Rohypnol causes amnesia, allows the person to still be compliant for certain activities, usually of a sexual nature, but not to really be able to make decisions as to whether or not he or she wants to engage in such behavior. So it's another club drug because it's usually administered at a club scene, but it's typically slipped into the drink of an unsuspecting victim. The person drinks the drink, they experience those effects of Rohypnol where they're now very compliant about things, they don't really remember what's going on, and so that's earned it its nickname as the date rape drug. For this reason, because it is typically slipped into drinks or some other way the individual is tricked into taking it, there are some test kits for Rohypnol that are often given out on college campuses, particularly universities with fraternity and sorority parties. There'll often be groups handing out these little test strips, or they've even developed a nail polish now that you can dip your finger with the nail polish into the drink, and there'll be a color change if the drink has been laced with Rohypnol. The best defense is just not to accept any drinks. Get your own drinks. Make sure you're getting the drink directly from the bartender. And if you set your drink down to use the restroom or whatever, don't come back to it. Get yourself a new drink. So that you don't find yourself a victim of this particular drug. Okay, moving on to another drug, this one, another hallucinogen, LSD or lysergic acid, typically known as just acid, although it does have some basic amine groups, and maybe a misnomer, but I don't think people are too worried about the chemistry of it. LSD is a very popular hallucinogen that was commonly abused in the 60s and still is today, although not probably in the same amounts. The LSD can be put in tablet form, liquid, gelatin, sugar cubes. These are the typical modes of entry. We see some images there on the right are some tablets of LSD, and then some different LSD paraphernalia. The chemist who first made LSD has a memoir where he talks about his own trips and the creativity and good feelings, euphoria that he experienced. John Lennon was a very famous LSD user, and actually his first marriage fell apart because his wife did not like using LSD. She experienced bad trips and did not enjoy it, and he was such a fan and so expected her to participate with him that probably more than anything else, that's what ended that first marriage. And this is from an account that she's given in various interviews. So again, LSD is often abused by artists, musicians, because of its link to improved creativity by their accounts. Alright, so the next drug we'll discuss is also a hallucinogen, like LSD, although this one much more dangerous. PCP, which is an abbreviation for the full chemical name 1,1-phenylcyclohexylpiperidine, commonly known as phencyclidine, or PCP is the most commonly way it's known. And as I said, it's another hallucinogen, but this one is much more dangerous than LSD. LSD can involve bad trips, as we mentioned with Lennon's first wife, and people do unfortunately do some unfortunate things, like believe they can fly and jump off buildings, and you do unfortunately see some deaths with LSD. With PCP, things get a lot more gruesome. You have individuals where they separate mind and body. PCP is what we call a dissociative drug, and so the body signals aren't making it to the brain in the same way they do for the rest of us. So the individual feels very strong, they don't feel pain. This sounds like a superhero power, but really it's a negative thing. The individual abuser may end up breaking body parts because they're not getting the pain signals, that they're putting too much stress or strain on a particular area. Individuals can also burn themselves because they're not getting that sensation, so they can get very severe burns. Sometimes those negative trips, they might have the sensation of spiders crawling on their skin, so they'll chew away at their own flesh, and they can bleed to death from the result. PCP is typically taken in by snorting or smoking, or just eating it, ingesting it. The PCP problem today tends to be with what we call wet, which is where a leafy substance, typically marijuana, is dipped in liquid PCP and then smoked. This is an issue in a lot of metropolitan areas. Again, smaller issue in smaller areas, but a bigger problem in places like Philadelphia and Camden, New Jersey. The case study for this chapter, if you have already read it, I apologize. It's pretty gruesome, but that's what happens with PCP. If you haven't caught it yet, you'll be assume shocked by what happened. There's an African American male who sexually assaulted a young girl, and her 6-year-old brother came to her defense, and he killed the 6-year-old boy, slit the throat of the young girl, although she did survive, but had no recollection of it when he was questioned by police. Kept asking how bad did I hurt them. The same week, you had a mother kill her own 2-year-old, decapitate the young boy, and then stab herself to death. So really, really gruesome, very negative trips on this particular drug, and a very problematic drug. Fortunately, not as commonly abused as a lot of the others we've talked about, but still a very dangerous drug. And if you're an officer that has to respond to the scene of a PCP addict, you're likely going to have to use potentially deadly force if the person charges you. Even a bullet to the body is not necessarily going to stop someone because of that superhuman strength and failure to recognize pain. And the last illegal drug we'll discuss is psilocybin, which is from the psilocybin mushrooms, or hence its name, mushrooms or shrooms. It's another hallucinogen. Again, tends not to involve the severity of negative trips that we just discussed with PCP, but still can give rise to an altered sense of reality. That's the whole point of a hallucinogen. And so people can make poor decisions and injure themselves or others while they're on psilocybin or LSD. But again, PCP tends to be the most severe of these hallucinogens. So due to all these problems we've been discussing with these commonly abused drugs, the U.S. government has instituted, quite a while ago now, a Controlled Substances Act. So this was back in 1970, and it established the 5 categories, or schedules as they're known, of drugs based on use and abuse. And again, all controlled substances would be those which you need a prescription to obtain. And based on the schedule, maybe prescriptions are possible, maybe they aren't. So let's take a look at each schedule in detail. So looking at Schedule 1, these are the most dangerous drugs, so these are the ones that I just mentioned cannot be prescribed. The other schedules can, although we'll see Schedule 2 has very limited use. So Schedule 1, there's no accepted medical use, and therefore these cannot be prescribed. They have their high potential for abuse, and again, this is a federal law, so when we get to marijuana we'll talk, but heroin, because of its very high potential for abuse and the fact that we do have other narcotics that could be used in its place, it's on our list as a Schedule 1. Marijuana federally is still, I believe, a Schedule 1, although, as we mentioned, certain states allow for its medical use, and Colorado allows for its recreational use now. LSD, MDMA, LSD mix, Psilocybin, these are all Schedule 1 drugs. They don't have any accepted medical use, and therefore they cannot be prescribed. On to Schedule 2, these have limited accepted medical use, so they can be prescribed, although you wouldn't commonly see prescriptions written for most of these. High potential for abuse, opium and morphine, codeine, cocaine, these the first three all opium derivatives. And methamphetamine, as I mentioned, it was originally accepted as a diet pill for weight loss. Now, of course, very few people, if any, prescribe it. And PCP, the really nasty one that we spent a while on in our case study involved for this chapter. PCP was originally developed as an intravenous analgesic, an intravenous painkiller, and I guess still could be used in that way, although based on what it does to the mind, and especially those who have potential mental illness, it's not commonly used at all anymore. Now we've hit the middle, so Schedule 3, sort of the middle of the road, some accepted medical use, but a medium potential for abuse. So again, we don't list particular examples here, but you could imagine we're moving into things that probably we didn't discuss much as abused drugs, because they're less likely for abuse, although anything can be abused. And I know a few years ago there were these candy parties or candy bowl parties where young kids would just bring whatever prescription drugs they could take out of their parents' medicine cabinet and just pour them into a bowl. You take a handful, and who knows what you get, because obviously you're not supposed to be mixing those drugs, and you don't even know which ones you're taking. So hopefully that particular trend has stopped, but Schedule 3 prescription drugs would be much more common, things you might find in parents' or grandparents' medicine cabinets. On to Schedule 4 now. These are lots of accepted medical use, much lower potential for abuse. Of course, people can abuse anything, but it's less likely with this schedule of drugs. Valium, there's been something like, 500 million prescriptions written for Valium in the past year. So it's a very, very commonly used drug. It's an anti-anxiety type medication. You may go and get a Valium before you're going to go on a flight if you're anxious about that sort of thing, or before another surgical operation. So again, lots and lots of users, and some others, Xanax and Rohypnol. Again, Rohypnol might be used medically to purposely, as sort of an anesthesia additive to help with the individual not remembering the procedure or whatever. But as we said, that's very dangerous in the club setting. Finally, our last schedule, Schedule 5, lots of accepted medical use, the lowest potential for abuse, and typically these are things like high concentration over-the-counter medicines. So the typical dose for ibuprofen is 200 milligrams. Here the prescription might be for a tablet that's 800 milligrams of ibuprofen, so much more than the recommended use, and therefore the prescription's written because the physicians don't think we could handle just going and taking four of the over-the-counter ones. They write us a prescription for a tablet that's already got 4 times that recommended dosage. And because it's so high a dose, it needs a prescription rather than just over-the-counter. Alright, so finally now let's talk about what goes on from a forensic standpoint when an officer in the field suspects that a drug is being abused. So the field officer would have at his or her disposal what we call presumptory tests. And they're these little test kits that are specific to a certain class of drug. So you have a dozen or so different kits that would be available, and they're small. We're going to see an example in lab, and they're very portable for that reason. They can just stay in the car for quite a while and be ready to use when necessary. This is what we call a presumptory test. It determines if the drug is likely present. Alright, there are some false positives, so that's a problem. It's a quick and easy test, and it needs to be. Most officers aren't chemists, so they need to have a very easy to use and easy to interpret test. But in making it quick and easy, there is that issue that you can have false positives. They're not common, but they do occur, and therefore this particular test cannot be used in court. It's inadmissible. It's a color test typically, and the officer performs that color test in the field by putting a small amount of the sample, the suspected drug, into the little plastic baggie that the test comes in. Breaks the ampules in the order indicated. If there's multiple, sometimes there's just one ampule, and then notes the color change according to the instructions. And so if the test is positive, then the officer has reason to believe that it is indeed the illegal substance, and most of the time it is. However, because the presumptory test can have false positives, this all has to be followed up with a confirmatory test on the suspected drug. So it's the confirmatory test done at the crime lab that proves the drug is present without a doubt. Unfortunately, this is a longer and more thorough test, typically GCMS or GCMS FTIR, depending on the purity and what's available at the crime lab. But this is, unfortunately, with all of the drug evidence, this is one of the reasons we have backlog. It takes a while to do these analyses. They have to be done at the crime lab by a trained forensic scientist, and that does take time and expense. This governor, current Governor Cuomo, and previous governors have attempted to close the Fort Crane facility. But again, as one of 3 state crime labs with a drug emphasis, it would be difficult to close it and still maintain the right of the suspect to a speedy trial, because closing one of 3, you're going to have much more significant backlogs in terms of drug evidence in particular at the other facilities. So I think they should be fairly safe there for the near term anyway, unless we figure out how to deal with this drug problem and solve it. Alright, and finally you see some more examples of these tests. NIK, Narcotics Identification Kit, is probably the major supplier of these tests. And you see a few different ones here. Far left shows the marijuana test kit, and then there's methamphetamine or MDMA test kit in the middle, and then finally a heroin test kit on the far right. So probably the 3 most popular NIK test kits for our area based on the illegal substances that tend to be abused here in the southern tier. So hopefully you've gotten some good information and are ready to move on from illegal drugs into our next topic.